Hello and welcome to Valley Viewpoint. Maybe you haven't been thinking about your skin lately, but we're going to be talking with an expert in this area and we'll see just how important that is. So Vicki, welcome to the program. It's good to have you.
Thank you.
And just tell us, why is our skin so important? I mean, I know we want it to look nice. We're taking pictures, you know, we want it to look great, but there's more to it, isn't there?
There is more than taking selfies and getting likes, that's true. So our skin is our largest organ, as most people know. It protects us from germs, it keeps everything inside, it protects us, it keeps us comfortable from cold and from warm, so it thermoregulates. It's just the most important thing that, you know, like I said, holds everything together. Without skin, we look pretty crazy.
Now, I've run summer camp for a number of years, and I know one of the things that we have emphasized with our kids being outdoors so much is we want you to protect your skin. We provide sunscreen and so forth. What are some of the things that people should be aware of when the summer gets here about protecting their skin, and why is that important?
Well, it's like I say every single day in clinic. It's not what you're doing right now in your 60s and 70s. It's the sins of your youth. Just like all the fast food we ate and all the terrible decision making we made in our teenage years, the decision making all the way down to 2 and 3 years old really matters. So protecting our children's skin now is very important. So it's the sunburns and the sun tans that actually continue on. Think of it like a cumulative thing. The more often that you damage something, the less ability it is to heal. So basically I tell people it's like burn, peel, repeat, heal. Burn, peel, repeat, heal. Burn, peel, repeat. Oh, didn't heal correctly. And now we've got a little area of that didn't heal just right. And now that area is an area of damage that now cancer cells can come to. So we want to make sure that we don't have all those areas and we don't burn out, our cells, so that we don't have, the damage to our DNA.
So how much sun is too much sun?
Really, if you're getting any kind of burn, it's too much sun. You should be able to, a few minutes out in the sun is fine every day, but you should not be out there enough to ever burn.
Now, a lot of times we think about skin condition in relation to the summer. There's so much emphasis, use your sunscreen and so forth. But I know in the wintertime, we get winds, skin can get chafed, it's cold, sometimes not only sub-freezing, but in this area, sub-zero. So are there things that we should be doing in the wintertime when it gets really cold or really windy to protect ourselves?
Sure, just like I mentioned at first, that's our barrier. So anytime you have a breakdown to your barrier, whether it's not, moisturized enough so it breaks down, so it cracks open. Anytime there's a crack in your skin, you could get bacteria in your skin, then you could get a secondary infection. So you want to make sure your skin is nice and moisturized. Same thing with a wind burn. You want to protect your skin, you want to make sure it's moisturized, that it's not chapped, that it's not painful, because everybody knows that dry, itchy, flaky skin is irritating and it's not comfortable. If your skin is itchy, you might, actually itch that skin enough that you crack it open. So you want our barrier to stay closed, and that's why it's so important to take care of it year round.
So give us some practical ways to protect our skin. What can we do?
Well, practical ways, obviously, like wearing a hat. If the good Lord gave you a haircut like you did, my dad went to the same barber, the Lord, and so he also needs to protect his head because years and years and years of damage have caused him to have many, many sunburns and suntans on his head, which have caused him to have precancer and cancerous lesions on his head. So wearing a hat is very important. Even if you're a woman, if you've got a part in your hairline, that's very important. Or if you have very light hair, that's also very important to cover your head. So when we cover our head, are we covering the tops of our ears? That's also an area that could also get damaged very often. And believe me, ears don't cut that well. So think about that. That's all cards. You don't have a bunch to pull it together. The tips of our noses are also a way. So sunscreen on our face is great. Wearing clothes or a long sleeve shirt most of the time is actually more cooling. I tell people, have you ever seen any migrant workers outside in a tank top or a bikini? Never. Why? Because they know if they're out in the sun, they need to protect their sun, and they're actually cooler by getting a little bit of sweat and then the breeze going through with the sweat. So clothing can help, but obviously sunscreen can help on your children, reapplying the sunscreen often, because it doesn't just work to apply it once. The longer you're out there, you know, the number on the sunscreen is how often you should be in applying it. You know, basically, if it says 60, apply it every 60 minutes. So look at that, you know, kind of use the number as your guide.
Okay, very good. So that sunscreen actually will wash off if you're swimming or skiing or doing these kinds of things, right? So you have to keep, don't just apply it at the beginning of your 3-hour stay.
Exactly.
Do it periodically to reinforce that protection.
And you know, my own children, I actually have went to a spray for convenience, because I do have 2 little children that are 7 and 9, and they actually think sunscreen cools them down because I use the spray. You know, sometimes the creams can be kind of ooey gooey, and if you're with sand or you're with food or you're on the boat, it's like you don't really want to, you know, get that cream out again. So get your spray out, and we just apply it every hour. And I actually say, get over here so I can cool you down, because it actually has, you know, a little bit of that propellant in that is alcohol. So alcohol is cooling to the skin. So many people have went to that. It also is less likely to break you out on your face, because alcohol is actually a little drying, so it's going to dry up some of that oils you're making out in the sun too. So you can spray a little on and put it on your skin. So you know, there's a few ways that you can kind of use sunscreen towards your benefit, not just the sun protecting, but also it's like, oh, I don't like sunscreen, it breaks me out, or it makes my hands too messy. So, you know, think outside the box.
Now, you use the scary word, the C word, cancer. You also gave us some other terminology, precancer. What's the difference between precancer and cancer? How can you tell? What are the signals that maybe you ought to have something checked out?
You know, precancer means eventually it's going to turn into cancer. Is that in a year? 10 years, you know, we don't really know, and nobody, you know, is waiting for that 10 years. Nobody's smart, I should say. And so, you know, is your skin rough and it just won't ever get undry or go back to a normal smoothness, even though you use lotion every day? That's typically what people tell me. I use lotion every day. My head's still really rough all over. It's like, okay, well, that's not just dry skin. That's precancerous, and we call that actinic keratosis. So that's a precancerous that eventually will turn into squamous cell carcinoma. And there's actually 3 types of skin cancers. Not every skin cancer is melanoma, even though that's kind of the one people know about, and that is definitely the most important one to know about, because it is potentially life-threatening. But there's actually 3 types, and so there's basal cell carcinoma. That happens on sun-exposed areas. It happens on your face, on your ears, on your scalp, you know, on your back if you took your shirt off a lot, mowing the lawn when you're a kid, on your legs, on your arms, and it's pretty common. It looks like a pimple that won't heal. It looks like a sore that I've had for 9 months. It looks like, that's just not normal. You know, you've had a sore for a week and it goes away. You've had a pimple for, you know, even 2 weeks it goes away. But anything, you know, past 3-4 weeks, you should probably get it checked out. That's probably, you know, not a pimple. It's something we should probably investigate further. A squamous cell can look like that, a basal also, but it's also something that doesn't heal, and it just doesn't seem right. And there's different types of squamous cell. One is called a keratoacanthoma, and you have to spell that later. So just so you know. So the keratoacanthoma almost looks like a cyst that's erupting out of the skin, and it actually grows very quickly. So that's, you know, people will come in, well, I went to the ER, they tried to drain it, nothing came out. It's like, well, that's because it's not a cyst. So that is also a form of squamous cell. And squamous cell is a little bit more scary than basal cell, because basal cell typically does not lead to death, but squamous cell could lead to death. It's slow growing though, so like I tell people, you'd have to try pretty hard unless you had something wrong with your immune system. Like if you were a transplant patient, like you'd had a kidney transplant or a liver transplant, and you were on medicines that suppress your immune system, then squamous cell can grow very quickly. But typically, squamous cell does not lead to death. So get in and get it taken care of. Now, melanoma is its own thing. It doesn't read books, it doesn't pay attention. You'll see melanomas from very, very little, like the tip of a pencil, all the way up to huge, big spreading. And the little one led to death and the big one didn't. And so it's very interesting like that. So there are a few, key points, but the thing I always say about skin cancer is easy. It's on the skin. It's not like, colon cancer or breast cancer that's inside your body and you don't have any early indication, except for your routine, mammogram or your routine colonoscopy. You literally, it's like, hey, honey, you got a spot on your back and that looks different. And that, has changed, I've noticed. And of course, that is many times how people find skin cancers. They found it or their spouse found it.
Now, let's say that someone has had a diagnosis. They have it. What's going to happen next?
When you come in, let's say that you're pretty sure that it's something irregular, then we're going to take a biopsy that day. So we're going to, numb the skin topically with a little needle that's going to go underneath the skin and just infiltrate right there. You're not going to be, put out. You're not going to have to, miss work. It's going to take about less than 5 minutes. And we're just going to shave that top layer of skin off.
So this isn't scary.
It's not scary. It's fast. It's very, very, most of the time people are like, you're done? What? I didn't even know we had started. Or sometimes people will say, well, do we have to do it today? And I say, well, why would we wait? Like, you're here now. We don't need to wait and watch. What are we going to watch? Watch you die? No, we're going to get rid of it. So when we do the biopsy, then we put it into a jar and it goes to a pathologist called a dermatopathologist. And these pathologists only read skin. And so they look at it and they cut it into sections and they see how deep it is, what's the diagnosis, how deep it is, and if I got it all just with that biopsy. After I biopsy, I actually use a little cautery machine, which is electricity that actually burns that little area, which does two things. It kind of seals the area so you don't bleed, but it also causes some destruction with that heat and energy so that any remaining cells many times are destroyed just with that. So many times it's a one and done. Unless the pathology tells me it's deeper, and then I come back, I call you back within a week, maybe 2 weeks, you'll come back in and we'll cut a bigger section, more like a wedge, and then we'll sew it closed into a nice linear scar. And same thing, just an infiltrate with some numbing with the needle, and then 20 minutes and it's closed, and then you've got a nice beautiful scar that you could make up a cool story about,
Well, we want to make sure that we get all the pertinent information and details. We're going to be going to a break, and I want to let you know that the contact information for the practice will be on our screen in just a minute. So if you need to get a pencil, a pen, piece of paper, because you have some concern that you would like to discuss or learn more about, well, be ready when the break comes. But this is very important. You want to protect your skin. You want to make sure that if there's a problem, that it's diagnosed early. It doesn't have to be a death sentence. It can be something that you can solve in just a relatively short period of time with the proper care. So don't go away. We'll be right back. We have a lot more to say about cancer, how it can be treated, how your life can be saved. We'll be right back. Hello and welcome back to Valley Viewpoint. I'm Dan Solis, your host, and my guest is Vicki Haines. She is a nurse practitioner who specializes in dermatology. Now, we were talking about cancer, and it sounds like a lot of these cancers, if they're detected early, if people do something about it promptly, are not going to be a problem. They're not going to lead to death. It's just a little bit of almost inconvenience, but what happens if a person maybe waits too long? I know there are people that say, oh, I don't want to see a doctor. Just leave me alone. It's nothing. And then it goes beyond that. What happens if we don't treat this promptly?
Well, of course, you're right. A lot of these, like talk about basal cell carcinoma, I wish they'd almost take the word carcinoma off and just call it basal cell annoyingness, because it is annoying, and they can get big and they can get bleedy, but, unfortunately, fortunately, they're not going to lead to death. Unfortunately, like we talked about, melanoma can lead to death, and so that is right. Getting in early is very, very important, but if you've waited, we've got to send you on, and now you're going to have to, instead of just seeing me, quick, easy, now you're going to have to see multiple doctors. And one of the doctors you'll have to see is an oncologist, and they'll talk about, has it went into your body? Are we going to have to do, chemotherapy? Like there's several, chemotherapy, people know that it goes through an IV, that you're going to have to do several treatments. And many times when melanoma gets into your body, it's not a good outcome.
So are we saying that it can start here, but if we're not taking care of it, that it can spread to those organs that we talked about earlier, the your lungs, the internal.
Typically where it spreads first is to your lymph nodes. So your first stop is going to be with a general surgeon or somebody who specializes in taking out lymph nodes. And your lymph nodes, like for your arm, we're going to be under your arms, or, on head and neck, are going to be on your neck. In your legs could be in your groin or behind your knees. So then they might have to take out 1 or 2 or 10 lymph nodes to see, do these have melanoma in them. Of course, getting your lymph nodes cut can lead to other problems with lymph draining. Now my arm is permanently swollen. So it's one of those things that, like we talk about early. After you go there, then, like I mentioned, you'll have to go to the oncologist. Am I going to have, chemotherapy or immunotherapy? After that, then you may have to have radiation. Will I have to have, radiation to the area? And sometimes even on early skin cancers, I do use radiation therapy, like on the noses, on the ears, on areas that I mentioned earlier are hard to cut, so that you're not physically maimed, so you don't, lose a whole nostril or lose the whole top of your ear. So, as you mentioned, and we'll keep, early. The easiest way, as I tell everyone, get naked with your dermatology provider every year. Just come in every year on your birthday month. Whatever provider, gets you in that year, it doesn't matter, if it's my clinic or whatever clinic you go to, having somebody thoroughly assess your skin once a year is very important.
Now, I know that there are other things, small growths. Some doctors refer to them as tags. That can be a little bit scary. Does that mean that I have cancer?
No, and there's many other non-cancerous growths, as you mentioned, skin tags or barnacles. Seborrheic keratoses is the big name for that. We call them barnacles because they're on the skin, they're not in the skin, just like a barnacle on a ship. And I like to tell people, the longer your ship is out at sea, the more barnacles your ship will collect. So it is birthday related.
Okay.
And so and the other part of your coming in once a year is your spring clean. Let's take off these non-cancerous lesions. Let's clean it all up so we can see what we're working with. And most of the time, insurance, if you say it's painful, itchy, your insurance is going to cover that. So it is a reason to come in. If anything's bothersome, then most of the time your insurance is going to cover that. Or if you need a cash pay option, it's very affordable. We're not trying to leech anybody here.
Now, there are many different fields of medicine that you could have gone into. What attracted you to dermatology in particular?
Well, my son was actually a wrestler here in Walla Walla, and as we all know, wrestlers are really great with picking up all kinds of skin stuff. Probably because skin integrity, their skin it can be open, it's touch skin on skin, so he had many rashes. And I was really frustrated with how hard it was to get into dermatology. It took forever to get in. And my background was actually in emergency medicine, so I did 10 years as a traveler. I worked in 18 different ERs, Washington, Oregon, California, and really wanted to settle down and have a Monday through Friday gig. And was very interested also in ER. I felt like everything kind of had the same thing, same name. It was always a dermatitis or a rash, and I was like, well, don't these rashes, aren't they different? This one seems different than the last one. So just from wanting to learn, and then when I got into dermatology, there's obviously I'm very passionate about cancer and saving lives, but there's other skin conditions that, you know, people don't realize that really affect their lives. And I say, you know, some of these skin conditions can change the course of their life. So if I have a terrible condition called hidradenitis suppurativa that I treat, that is like boils in the you know, the armpits and the groin and the buttocks, and it's a terrible condition. It's painful, it smells bad, and people tend to really become recluses and maybe not go out for those high school sports, or not, you know, maybe get to their full potential because of this disease. So if I can change that early at 12 years old and get them on a medicine where they can, you know, really, you know, go all the way up, then I've changed the course of their life. Or psoriasis, you know, psoriasis dates all the way back to the Bible, where they didn't know if it was leprosy, you know. So again, if you know, when you reach out to shake someone's hand, if they have a you know, a huge patch of psoriasis, you're like, oh, I don't want to touch that person. So again, you know, I get to change the course of that person's life. Acne, you know, how often have you seen terrible acne? You know, you can change the course of their life and give them back their confidence. You know, we mentioned at the beginning, right now we live in a selfie society where everybody's using, you know, filters. What if we get those filters off and this is really what you look like in real life? And so for me, that's why, you know, derm is an amazing field, and I'm very passionate because I literally get to see how I can change people's lives.
Let's talk a little bit about psoriasis, one of the diseases that you mentioned, because we see so much of this on television, people talking about psoriasis. How do you identify that? How is it treated?
Well, psoriasis is pretty easily diagnosed, and there's two things that kind of mimic, the two diseases kind of mimic each other, and that's atopic dermatitis or eczema and psoriasis. And there's great treatments for both nowadays, and they're both, you know, pretty much, you know, they're not, neither one of them are curable, but they're both very treatable, meaning that we can make it so they really go underground.
Do we know what causes them?
We do. We do know that they're autoimmune. We know that with atopic dermatitis or eczema, many times it can be an external, whether it's grass or trees or pollens or foods. We know with psoriasis it's an autoimmune, that it's part of the immune system that's overreacting. And so there's good drugs now out there that are extremely safe, that basically, you know, stop this part of the immune system from overreacting on both accounts and make it so they live a completely normal life.
Are these treatments that you apply topically, or is it something that you take internally?
So back in the day, we did do a lot of topical creams and ointments, but you know, they're ooey gooey. People don't want to use them. They're hard to keep using. So now, you know, many times we use injectable biologics, and some of these biologics are as easy as every 12 weeks. And so some of them are every other week, some of them are every 8 weeks, every 12 weeks. So they're, you know, like I said, it's as little as 4 shots a year and you have nothing on your skin. So they're, like I said, they are extremely safe. We monitor very closely. They're amazing. It's an amazing time to actually have psoriasis. There's many drugs in this category, and we do very much specialize in psoriasis and atopic dermatitis at Atomic Derm and Atomic Squared.
Now, for all of our teens who are now going through what we all went through, the outbreaks of acne, what do you suggest for them?
Well, for acne, we actually, you know, there's many choices, but I tell people, you know, it really boils down to 4 things. You do an oral antibiotic, a topical antibiotic, an oral retinol, or a topical retinol. And really, you know, in some conjunction of those, you know, that is really what you have. The topical antibiotics actually help, and the oral antibiotics actually help the inflammation. They also kill the bacteria on the skin. The retinols actually dry the skin out. So we know that acne is caused by an overproduction of oil, and that actually feeds the bacteria. So if you get rid of the bacteria or you get rid of the food, either way you're going to get rid of the acne. Sometimes it's so deep that we do have to use like the pill, the oral retinol, which is called isotretinoin, or the name people know it by is Accutane. And that too can be extremely safe. and we monitor our patients very closely. But we use a lot of that as well. We really, try to be, pretty aggressive and get people in and out. We try not to, drag people along where it's like, we're not really helping you, but you just keep coming back month after month. We really try to get down to the problem and really help you.
Does our diet make a difference?
That's kind of been debunked in a lot of ways, but there are inflammatory foods for sure. So when people tell me when I eat this, it makes my acne worse, it's like, well, then don't eat that, basically, but really that's been debunked by a lot of accounts, and many times parents will say, oh, they're just not washing their face. And it's like, well, usually that's not the case either. That's not why they have, that deep cystic acne. And washing your face may not be enough. That's just on the surface.
So there are a lot of myths that we had as high school students. Don't eat this, don't eat that.
I think that was our parents not letting us want to eat fast food.
Oh, well, that was probably pretty smart just for our heart.
Right.
But some of these things are going to happen. It's not you should feel guilty that you ate this, or
right.
You're not clean, you didn't wash yourself.
Right. And those things will help, like we mentioned, many times dairy can be inflammatory, some of the meat products can be inflammatory, and there definitely are inflammatory foods. They say carbohydrates can be inflammatory, but many times it's much deeper than that. It's more than, it is skin deep, it's all the way down to your oil glands.
I'll remind our audience that they can contact you at the information with the information that we put on at break. We want to thank you for joining us for Valley Viewpoint. If you have an idea for a future viewpoint or concept, well, call us 509-529-9149 or write us at valleyviewpoint@bmt.tv. For Viewpoint, I'm Dan Solis.